The federal government has activated stage 1 of its coronavirus pandemic plan ahead of international health authorities. Airports, schools, hospitals and nursing homes are ramping up preparations as the Prime Minister warns a global pandemic is very much upon us. Joining me live now is Australian National University Infectious Disease Associate Professor Sanjaya Senanayake. Good morning to you, Professor. Thanks so much for joining us. Apologies if I messed up your name there. First of all, can I get your reaction to this announcement?
Oh, good morning. Yeah, thanks for having me. I think it's not unreasonable and not unexpected. We aren't sure if we are going to have a pandemic or not. That's not a certainty, but I think it is a very good idea that we prepare for one because it could be a complex, prolonged process, and I think it's a very reasonable announcement.
Professor, just for those who don't know, what is a pandemic? What does it actually mean?
So there's no specific definition for a pandemic. So there's no typical number of cases or certain number of countries, but it's more a sense that there's an infection, it's spread to multiple countries and there's sustained local transmission and there isn't good control of it.
And that is a step up from an epidemic?
That's right. Well, an epidemic that involves lots of countries is a pandemic.
Yeah, okay. So a pandemic basically means it enacts plans to be able to get medicines, to basically stockpile a lot of preventative measures, shall we say, and get it ready for people to use.
So pandemics, although the plan itself might be very complex and multifaceted, in essence you're trying to do two things. So if there's local transmission of the COVID-19 in Australia, you're trying to make sure that people with the infection have a safe recovery, either in the community or at hospital, and that people with the infection are isolated and further transmission is stopped.
Where do you see this going? I mean, I just note this morning that Northern Ireland has now registered its first case. There's in excess of about 40 countries now who have had at least one case of coronavirus. What are your personal thoughts on this and where it could be going?
Look, I must admit there have been twists and turns with this outbreak, so I can't be 100% sure of what's going to happen, but certainly I'm more pessimistic now than I was a week ago with these new hotspots in South Korea, all these cases in Europe. Even though Europe has a lot of wealthy countries, it's one big landmass with fairly porous borders, so cases can travel from country to country before they're identified. So I think the next couple of weeks will tell us if we can get any sort of global control over this or whether it's going to spread further.
And of course, one of the big problems for this, I would have thought, is if it happens to break out in, say, a poorer nation or a third world nation where medical facilities aren't up to scratch and it can really take off there.
Oh, absolutely, and that has been a priority that's been mentioned a number of times, particularly by the World Health Organization, funding lesser developed countries to improve their surveillance systems because, yes, those systems could get overwhelmed by coronavirus. And of course, because a lot of the cases are mild, it may be some time before they are actually detected when someone sick enough comes into hospital.
All right, Professor, really appreciate your time this morning. Thanks so much for joining us.
Thank you.